So in this video we give a snippet of the history taking station of clinical MRCPCH exam. We give a scenario, we start with a scenario and ask the candidate to gather relevant information, and then we go on to discuss and provide the feedbacks. So let's start. Read it out for you that you're basically asked to speak to Mr. Grayson, who is a father of 6-year-old Lily, who has presented to the ED with acute cough on the background of her asthma. So it's an acute exacerbation of asthma. And you note from her records that the prescription for the last 3 months have not been picked up from the GP. The medication, the asthma medication prescriptions have not been picked up from the GP. Okay. So take relevant history from the dad, and then in your discussion with the management plan will be discussed. Yeah. So the 4 minutes are up.
Yep, I can start now.
Yeah. So this is 10 minutes for your history information gathering. Okay. So I'm starting now. Yeah.
Right. Hi, my name is Dr. Sarah, one of the doctor here. Are you Mr. Grayson, dad of Lily?
Yes. Hi. Nice to meet you.
Hi. Thank you. Nice to meet you too. Thank you very much you came in here. So before I start, I just would like to know that it's Lily and she's 6 years old. Is
Yes,
that right?
That's right. Yeah.
Great. So Mr. Grayson, I gone through your notes, and then I have seen that the GP sent me a letter that you haven't gone to, you had visited, or prescription is not be there since 3 months. I would like to know, so why you so I just would like to know in your words, what is your concern, or why you came in this hospital, then you wanted to see us?
Well, because my daughter is unwell, and as you can see, she's coughing a lot. So I just wanted to get her to be seen. And yeah, I've tried to be regular with her medications, but I think she's doing all right. I couldn't get time off my work, and I've been busy, and so I just couldn't pick up the medications really.
Okay. That's fine. So we are here to help you, and you did a really good job. So you came in here and then having a discussion with us. So anything else you would like to share with any other concerns for today?
Mainly, I just wanted to get my daughter fixed.
Okay.
She's been coughing since quite some time, and I think it's getting worse. So I just want to get her I would just want her to be all right.
Okay. So apart from cough, anything else you have she's complaining of?
A bit of chest pain on and off, but it's mainly the cough, and I think it increases with the cough.
Okay. Anything else?
Well, I can see her to be struggling. I brought her to the hospital mainly when the cough got worsened, and then I could see her struggling to breathe.
Okay.
So I just brought her here, and I think if she was breathing quite fast and rapidly.
Okay. Thank you so much. So let's do it in a step by step. So you said that she's coughing a lot since many days. So can you tell me, so how many days when it started, when you noticed?
So she's probably 3 days, I would say. She started having runny nose, and then she developed a bit of cough, and then we were not really bothered with it, and then it went on. The cough just went on increasing. It was more during when she went to bed. She couldn't just sleep, and she had to. And then over today, since this morning, she's been just incessant, non-stop coughing, and as I said, she was struggling to breathe as well.
Okay. Did you do something to relieve her coughing?
Yeah, we gave her. She's got some inhaler, a blue inhaler, and I think she took some of that, but it didn't really touch her,
Okay. So what color is the inhaler?
I think it's a blue one.
Okay, the blue one. All right. So since how long she's taking this inhaler?
Well, she's been taking this for when she started school about a year, about
Okay.
just over a year ago.
Okay, 1 year ago. Okay. And anything, so when she took that hair, so it was improved. Like you feel that the coughing, any improvement you feel?
I don't think she took few. I mean, she took some of that, but it didn't really help with her coughing. So we just had to bring her in.
Okay. Is there any particular something she has done recently, and then she ended up with the coughing?
Well, I can't point a finger to something, but
Hmm.
yeah, she does this frequently. She starts having out of the blue coughing,
Okay.
and then we have to bring her to the ED to get that sorted.
Okay. So is this the first episode she got, or it's a similar kind of things happened before as well?
Well, it has happened quite
Okay.
many times in the past, and we had to bring her to the ED. You could say probably
Mm-hmm.
once in 3 to 4 months.
Okay. Okay. And is there any fever or anything related to that cough?
I don't think so. I don't think she's had any fever.
Okay. And regarding the chest, so is that related to the cough, or what else you can elaborate?
I don't know really. I mean,
Okay.
yeah.
So, uh, so, so tell me about the chest pain.
So and she's not too bothered with it. I, she noted a bit of chest pain mainly after her coughing episodes. We gave her
Okay.
some paracetamol, and
o-
and then she was all right with it.
Okay. Good. Good. And regarding breathing, tell me more about the breathing.
So as I said, since this morning, her breathing was a bit rapid, quite
Mhm.
fast, and she was struggling to catch her breaths.
Okay.
It's then when we decided to bring her in.
And what you did with that? So you just right after decided what you did? Did you do something?
So yeah, we gave her. I mean, she took her blue inhalers, few puffs,
Mm-hmm.
and then it didn't really help her, so we just brought her in.
Okay. Right. Right. Okay. So regarding so you said the chest. Any pain in the abdomen related to that?
No, I don't think so.
Okay. And you said she got the palpitation, isn't it? So anything like
Sorry, didn't understand that.
you got the racing heart, isn't it? Today is having a fast breathing. Did she
Yeah,
racing
she
heart
was
as
breathing
well?
fast. She was breathing fast, but I'm
Hmm?
not sure about the other things.
Okay. Did she complain of anything else, like she's fainting, like she's not with her, something like that, or
No, no, not really.
okay, okay, that's fine. All right, okay. So you said that so yeah, 1 year before, so she has been taking the blue inhaler. So are you following with the team of the doctors?
Yeah, she's got a pediatrician, but it's been a long waiting list. I'm not sure when was she seen last, and I'm not sure when will she be seen next.
Okay, right. So are you educated well with the technique how to use the inhaler?
Um, yeah, I mean it's usually it's when it's her mom
Mhm.
uh, who used to take care of her, and she
Mhm.
managed her medications and everything. And I think Lily should also be knowing that.
Okay, right. So is there any? So you said that she got many hospital admission because of such kind of similar attacks she got. So each time they treated her. So did you remember what kind of treatment she got?
Yeah, so they just give her some medications through that machine that makes noise.
Uh-huh.
What do you call that? And then she has to stay in for probably just overnight, and then she gets better.
Mm-hmm.
And a white tablet as well. So
Okay.
she gets that some white tablet, and she regularly gets that
Okay.
uh, inhaler. Yeah.
Okay. Okay, okay. And anything else they prompt like something like is not like not getting improvement, or they tighter up the doses or something?
Well, she was started. I think few months ago. She was prescribed some brown inhaler as well, but
Mm-hmm.
I'm not sure what that is, and I'm not sure if she's using that or not.
Okay, no, no problem. I'll let you know. So, what is that? And then, yeah, I just need to know. So, what happened, and then, how you doing that, and how Lily is taking it. Thank you so much. Okay, so I would like to know that, is there any traveling history? Recently traveled somewhere?
No, no,
Okay, is there any at home anyone else having a flu, and they're running nose, something like that?
no.
Okay, so since she's going to school, so yeah, so I'm just wondering about that. So someone else having a viral illness, that's why I'm asking you. Okay, right. Okay, so regarding
Yeah.
her,
So that's 10 minutes up.
The station is 23 minutes, of
yeah,
which 14 minutes you need to take history. Af-
exactly. I'm saying
af-
that.
but as Dr. Rai said, after 10, 11 minutes, there will be a
Yeah.
knock. Okay. In that knock, you will have to summarize, try to conclude your history taking. Okay.
Uh, okay.
After
Mhm,
14 minutes,
mhm.
the actor will leave the room.
Start again.
Yeah. Okay, so 4 minutes start, please. Okay. Any allergies Lily has?
So she's got a bit of. I mean, she has this hay fever and she gets a bit of eczema.
Mm-hmm.
But apart from that, she doesn't have any other food allergies.
Okay, okay, great. And is she growing well? Is there any concern about that?
Yeah, she's been fine. Apart from this, she's not had any other things.
Okay, and does she has a immunization up to date?
Yeah, I think so. She would have had all the immunizations up
Great,
to date.
great.
Yeah.
And regarding your family, how many people are you
So
living
I've got so I've got two other lads. So we've got
together?
Lily, and then I've got a 5-year-old and a
Mm-hmm.
4-year-old.
Mm-hmm.
And then I've just recently separated with my wife.
Okay.
So yeah, it's a bit of struggle.
Yeah, yeah, definitely. So if you are think coping everything by yourself, so definitely it could be a rough patch for you. So how you manage that then in that way? So you are working, and also as you are having a visit
Yeah, so
daily.
I'm working full time,
Mm-hmm.
and I've got sometimes the nanny comes in, and sometimes the kids go to their mom's place
Okay.
twice a week. So we're just pulling it through, you know.
Okay. And then regarding your financial stuff, are you happy with that?
Well, to be honest, I'm struggling as well in the financial aspect. That's why I'm having to work full time, and so I'm not able to.
Mm-hmm.
Yeah.
Okay, okay. So we will work on it, and we'll having a discussion with that as well. Don't worry about that. And regarding the home environment, so is that carpeted, or is the floor and concrete floor?
Yeah, it's a wooden flooring.
Okay, okay. And Lily, so did she say anything regarding school? So she's not comfortable. She doesn't want to go to school, something like that. Anything bothering her? Have you noticed?
Well, because of her, coughing problem, she's
Mm-hmm.
she's she's been missing schools off lately.
Mm-hmm.
Uh, so we've had to. She's requiring this blue inhaler quite
Mm-hmm.
often, and because of that, she's been missing schools
Okay.
in
The
between.
nurse at school aware for her inhalers, and she's educated well for that?
Well, I need to check that with the
Okay.
school.
Okay. So if we were also having our discussion with that as well. We're gonna help you if you need it. Okay.
Yeah,
So are you smoker?
yeah, I do smoke.
Okay. So how at home, outside, how you do that?
Sorry.
At home, or how you manage to do that? So how
Well,
what?
I go outside the home.
Okay. Okay.
Yeah.
And do you have any emergency plan for her at home?
Yeah, I think there is an emergency plan there.
Okay.
Uh,
Okay.
yeah, but I'm not exactly sure. I need to find that out.
Is there her diary is up to date regarding her things?
I'm not entirely sure on that.
Okay. Okay, we will talk about it as well. Okay. Do you have any pets at home?
Yeah, we've got a dog.
Okay. Okay. So since it's a lot going through with you, how are you coping all things together? Do you need any help from us?
Well, I just want to get her sorted really, and that's it. Indeed.
Okay.
Yeah.
Okay, for sure, we're gonna help you.
Okay.
Let me go through it, and then let me check what's going on exactly with Lily. Okay.
Yeah. Yeah.
Okay, I'm finishing now.
Fine. Okay. Yeah. Good. So you've managed to gather a good load of information there after the warning. So yeah, that's good. So here, as you can see, the candidate did manage to gather a lot of information. However, in the later part of the discussion in the clip, you will find out that the candidate realized what other things which she missed, and we provide a feedback on what she could have improvised. So as you could see, the role player, who was the dad of the girl, didn't actually know a lot of information about her daughter, which was a deliberate part of this history-taking station, that the candidate was expected to pick up the clue that the dad wasn't aware of a lot of aspects with regards to the care of her daughter. So let's see if the candidate was able to identify that, and that will tie up into the management plan as well.
Oh, I need to ask about the family history. I forgot. Because the family history of similar condition like asthma, it is very important actually. So yeah. I need to talk about that. I forgot why 4 minutes on my head or above my head.
I just want to add family history. See, I will send you a picture where there you have to basically streamline your thought process. Okay, I felt like you're haphazardly asking a lot of questions. Okay, so I'll send you a picture where I have jotted down a structure in which you maintain that. See, you didn't ask anything about birth history. Okay, what if there is this is a preterm with chronic lung disease?
And yeah, I wanted to give the feedback as well. When you started the history taking, the first question you've asked, that why didn't you pick up the medications? It was asking as if, what's wrong with you? Why are you not picking up the medications? I
forgot to what to ask actually. I forgot what to ask, and I said, okay, what to say.
Yeah, so that was, I myself was slightly taken aback first and the role players are really good at it. Their role players are really well trained. They can get upset. They can start. They can give you a negative emotion. They can start crying. They can start getting uncomfortable and unsettled, and that will put you off the track when they start doing it.
Yeah. No, I did wrong actually. I realized because I initially I said okay what to say, and then I just whatever came in my mind I said actually. Yeah.
Don't worry. Okay, these sessions are basically meant for you to make mistakes.
Yeah.
Okay, the more you make mistakes, just jot it down, and then next time don't, so that you're aware of all this. So by making mistakes, don't worry. Okay, the basic agenda is for you to make mistakes and learn from it.
Yeah. So I will just quickly share my screen, and this is a common format. Are you able to see the screen now?
Yeah.
So this is a common format for all the history taking station. This is the format. A long-standing fever, and then when you try to explore what are your concerns, they will tell you that I'm thinking of a cancer. So that will come in your management plan to address that point. Okay. Domains where you are marked. The most important again is information gathering. You have to be sensitive as well, as they mentioned. Like especially gathering the family history and so one of the ways to get the smoking history, especially in these asthma ones, you need to get smoking and pets and any family history. That are there any smokers in? So this was the cut short version of our history taking sessions in our regular online classes. So in later part of the discussions, we provide the feedback on how to take the history, how to gather the information in a structured format, and what are the points to consider if you have the diagnosis known, and in those instances where you do not have the diagnosis known, the approach is entirely different. And how to gather the clues of non-verbal aspects. If the role player gives you there could be an underlying social cause, and how to add that in your management planning. So these are the points that we need to consider in this particular station. It is the station that carries the second highest marks, so it is very important that you do not miss out those findings which are non-obvious part of the history taking station. So join our course to learn more and improvise your chances on passing your clinical MRCPCH exams, and how to meet standards in all the domains in the different stations.